So welcome you all on this edition of the TIB seminar series on the digitization of research and education. This is a regular event organized by TIB where both Brian and I are working, and the aim of this seminar series, what we have a talk about every 2 months, is to shed light on interesting research and interesting projects in and around Hanover, where our organization is located. And today we make a little bit of exception. So today we're going to talk about mental health, which is not directly related to digitization, but it's definitely something what many of you came across with as an issue or as a problem, especially in this, I don't know if I can call it post-pandemic time, because Germany was slowly getting out of the darkest hours of this pandemic, but still we have to live with the consequences. And especially in education, we are experiencing the consequences of isolation, of well-being levels, let's put it mildly, not, how to say, fit for proper working, So I would like to introduce you Brian Cahill, who's the grant manager of the Researcher Mental Health Observatory project. This is a cost action. Brian will probably talk about it in details. The cost action, what both Brian and I are leading, and an action what is open for everyone who's in academia or who's related to the topic of researcher mental health and researcher well-being. Brian, the floor is yours.
Thanks very much for the nice introduction, Gabor. I will talk mainly about my own personal experience in how I got involved in this topic, and kind of the work that has been done leading up to the project starting. So that's kind of what evidence is there for increased levels of mental health problems among researchers. And this is just to talk about myself and my own personal background, that I was kind of first chair of the German chapter of the MRC Alumni Association, and then that was in 2015, and then in 2016 to 2018, the chair of the MRC Alumni Association. And in this role that you meet a lot of young researchers and a lot of researchers in general, and it definitely that you get the impression that there's a lot of problems because many people approach you with problems. And this was something that was shared by many people leading similar organizations throughout Europe. And this was just a kind of a feeling, but there was no real data or evidence about it. And then in 2017, in the middle of my kind of term as chair of MCA, paper came out from Cahill that had very high impact. It was about the work organization of mental health problems in PhD students. And it showed, this is just kind of table 4, it's one of the main kind of tables. And if you look at the second column, PhD students, and then on the first column, kind of the various indicators of mental health problems, kind of feeling under constant strain was 40%, and unhappy and depressed was 30%. So this was a relatively large group of 3,659 PhD students in Flanders. And I think well, reading this, most of us knew this wasn't just Flanders. It was kind of many of the other countries within Europe. So I was approached with this, actually the first time I heard about this paper was from a PhD candidate who had been in Germany at the very first meeting I organized for MCAA, and that she left her position and she wrote a blog about this paper. So I kind of followed it and looked up this paper, and kind of leading up to this, I had already could have met Gabor and talked to him about the training that he was providing in his, he was then running an ITN at the University of Amsterdam, and that was in 2016. And I had also talked to Francisco Gonzalez. He was a PhD student at the time within the Marie Curie Alumni Association, who had set up a social startup that was offering mentoring to international researchers. So we started looking further for evidence, and we found from Susan Guthrie of the RAND organization, who had written a report on understanding mental health in the research environment, a rapid evidence assessment. And she didn't look at just PhD students, but she also looked at all higher education staff, and the conclusion of her report was that they had worse well-being than those in other types of employment, and that was even including hospital staff, which was similar to hospital staff. So I think this was something that I didn't think was going to be the case, but that it saw that the majority of university staff find their jobs stressful compared to high-risk groups. That PhD students had specific challenges, high work demands and work-life conflict, and low levels of control, poor support from supervisors, exclusion from decision-making, and that academics were hiding their mental health conditions from their colleagues and from their employers, that they felt they had insecure work conditions, that gender was a big issue, and that many researchers really love doing research, and spending time on research is associated with reduced stress. I think this is something we can understand, and that poor well-being was impacting on productivity. That the impact of stress and job satisfaction of researchers is well clear. Is that very often researchers are under stress, but they love their work so much that they're willing to put up with it. That there is evidence on the effectiveness of and evidence of the effectiveness of mental health interventions is limited. This is something that this project, the ReMO project, will look to address, to see which interventions and which actions are actually effective and can be recommended to institutions. That another person or group that's involved in our project is Inge van der Weijden from the University of Leiden, and she and her colleague Ingeborg Meyer gave the first webinar in this series, and that in 2017, in around the time that I was talking about, she published a report on the mental well-being of Leiden University PhD candidates. She reported on this back in April, but I just looked at it. What I found particularly interesting about this report was the suggestions for addressing problems, that appoint independent psychologists and to take particular care with international PhD candidates, and to have an emphasis on career coaching and training in transferable skills. One of the points that she picked up on is on supervisor training, and this is one of the first things when I was talking with Gabor, that I was very impressed by his ITN, that it provided training on mental health issues for the PhD candidates within the project, but also for the supervisors. And I thought this was a very, very good way to work. But I think that supervisor training is also good for institutions, because young supervisors, even older supervisors, often have no training in management, and in many of the requirements that they have for making their own career. If they only have excellence from the point of view of research, that training can bring them up to speed on many of the other managerial issues that they will have to face during their career. That there should be transparency with regard to requirements that PhDs candidates must meet, and mentoring should be provided also monitoring of well-being of candidates and evaluate interventions. And this is one of the things that this project will be doing, is to evaluate interventions. Another one of the stakeholders that was publishing or was active in this field was vitae, and also kind of Nicola Byram of the UKRI funded Student Mental Health Research Network SMARTN, that Janet Metcalf, the chair of our working group 1, was involved in this survey, and this was it was published last year, or made available last year, and showed the impact of COVID-19 on doctoral and early career researchers. So I think that we've all had some stress over the last year, but in particular for doctoral candidates with particular issues due to, and in some ways, the pandemic intensified existing inequalities in research. So, and tended to affect students in compared to more established researchers, females in comparison to males, those working in the arts and humanities in comparison to the medical sciences, those with disabilities, and also international researchers. So I think that firstly, within MCAA, where I was active at the time, that the first set of actions that we took was to raise awareness. And raising awareness is one of the first things that you do when you start working in a field. And I think here's a photo of our action share at the MCA annual conference in 2018 in Leuven. And researcher mental health was a major topic in the plenary sessions of that conference. And it also became a bigger topic going forward in the years afterwards. That one of the first actions we took was to submit a session at the Euroscience Open Forum. That was work we were doing in 2017, and we delivered that session in July 2018. And to do so, that we reached out not to our own members, but also to people from outside the association, like Cahill, Susan Guthrie, and also Mark Robinson, who was from the Student Counselling Service of Trinity College Dublin. So we had a representation from early career researchers, but also from researchers, from practitioners. That we published an article, and in after ESOF, that two of our speakers were interviewed by Science and by Nature about their experience, and so we had a lot of attention for our topic. That we also, directly after ESOF, we submitted a session for the vitae conference, because we wanted to see what career advisors, and the vitae conference is one of the biggest events in Europe for people who support the development of researcher careers. And we did this. I reached out to the then president of Eurodoc, Garrett O'Neill, and he advised me to talk with Matthias Schrein, who is now involved in our project as the communications manager. And we set up a session that September, a workshop session at the vitae conference. That Garrett O'Neill had been, and Matthias had published an article earlier that year on early career researchers and their mental health. And Matthias Bjornmalm, who was involved in setting up the workshop session, had also published an article in Nature about researcher mental health and changing the culture of research. Matthias had also represented Eurodoc at the EUA Council for Doctoral Education on safeguarding the mental health of doctoral candidates in Europe. And vitae, who were also represented in the project through Janet Metcalf, had expanded their researcher development framework, which is their main tool for helping researchers address, and career advisors for addressing career developmental issues for researchers, had developed a well-being and mental health lens for their RDF framework. So what issues do researchers have? I think there are very, very many issues that researchers have. I think the uncertainty and precarity of research careers is certainly one of the issues that researchers have. The lack of independence, lack of opportunity to develop independence is another topic. And for a researcher, traditionally, getting a PhD meant that you had become an independent researcher. But with the postdoctoral phase being extended much, much longer than PhD, I think developing independence becomes a bigger issue, particularly at the postdoc level. International researchers have particular issues, particularly with regard to integration and avoiding isolation, and the lack of support for researchers from support staff, and lack of support for support staff in universities. Conflict with supervisors is a very, very common issue, and this is something that the supervision at the doctoral level and also at postdoctoral level is something that the Commission has begun to address, and in particular, referencing Gabor's work with MCAA and the sustainability of research careers, and imposter syndrome. And this is something that holds back some researchers, and to some extent it's completely natural that if you're doing a PhD that you begin not knowing everything about a particular field, but there is a lot of pressure to get up to speed very, very quickly and become an expert overnight. And of course that doesn't happen. But with most PhD candidates, by the time they defend their thesis, they're the person in the room that knows the most about that particular issue, after having done so much work and written a thesis on it. The publish or perish culture is something that very much puts pressure on PhD candidates, that many are required to publish 4 papers, and this is the number 4, without any regard to the quality of those papers or the amount of work that needs to be done, or whether they're in a field where there is a lot of low-hanging fruit or not. So we have poor supervision and poor communication is a continuing issue, and poor communication can be on the side of the supervisor, can also be on the side of early career researchers. So I think this is one of the things to establish clarity within supervision at the earliest possible stage. Financial problems are definitely a problem, that very often researchers have a certain length of funding, and after that it may take longer to finish the PhD. So this is very often unpaid. And then to have work-life balance as a researcher, where very many people sacrifice their own time for research. And how early career researchers can address mental health issues at their own level. And it's mainly by looking after themselves, looking after their own well-being, by sleeping well, by keeping up sport and hobbies, by talking to friends, colleagues, and family, by being open, if they need to seek professional help, and to decrease career stress by thinking about their life after PhD or after postdoc as early as possible, to take part in training courses, and is also a way of decreasing career stress, and to talk about their situation and about their future. And join extracurricular groups. It doesn't have to be Eurodoc or MRC Alumni Association. It can be any sort of activity that gives you pleasure, if you want to sing in the choir or whatever it is you want to do. But this project is mainly focused on kind of how to fight mental health issues at the macro level, how to raise awareness among European stakeholders, to invite them to speak in our meetings, at our stakeholder events, and to develop proactive policies for mental health, to push for support for early career researchers and mid-career researchers, or for all researchers, to push for more positions for PhD counselors, and to push for funding for mental health research to gather evidence on the state of the problem, but also how to address it, and push for more sustainable research careers. So much of what we're doing is focused on getting action at the policy level and also at the institutional level, but much of what we're doing is bottom-up action. One example that I'd like to present is the Max Planck PhD Net, who did a lot of work gathering evidence in a very professional way and raising awareness, but also running training courses, kind of building alliances with stakeholders such as health insurers, and when in 2018 there were a number of scandals within the Max Planck Society, particularly with regard to bullying by supervisors. And at that time, Jana Lasser, who was involved in our project, was the spokesperson of the Max Planck PhD Net, and within 1 week of a big scandal breaking within the Max Planck Society, she had published a position paper on power abuse and conflict resolution. So it meant that she wasn't complaining about the situation, she was suggesting something that actions that could be taken by the Max Planck Society, and very, very sensible suggestions as well. And many of the suggestions within this position paper were implemented within the Max Planck Society. I think within Germany, many of the other institutions saw the situation and reacted to it by being proactive and finding ways to avoid having the similar problems themselves. Within the Marie Curie Alumni Association, I think leading on from Leuven in the next year, that two young psychologists who are both involved in our project set up the Referent Mentoring Initiative. So this is a peer mentoring program that is aimed at early career researchers and kind of leverages mentors from within the membership of MCAA, and they kind of to give support to younger researchers. And Stephanie is now the vice chair of this cost action, and Dara is the working group 3 chair. So this is a cost action, and that we are very much focused on early career investigators, and this and also integrating the leadership of the cost action. The capacity building of objectives of the ReMO project are to build research across different disciplines. We have very, very many stakeholders from academia, from psychological practice, from the private sector, from civil society, from research management, and also researchers of all career stages. We're creating institutional links for transferring knowledge and best practices between countries, and we're contributing to the research capacity of at least 100 early career investigators over the lifetime of the project. We offer mental health support to early career investigators, and we're very often asked to speak at meetings, such as last week I spoke at a meeting of international PhD candidates in Belgium at the UC Leuven, that we offer mental health support. We stimulate science practice exchange and the co-development of knowledge by offering short-term scientific missions. These are short research visits, which you can apply for on the eCost platform. If you want, I can put a link into the chat. And kind of we want to use our network for setting up these short-term scientific missions. We have a certain amount of budget reserved for this, and we would like to use it up before the end of October. So if you have ideas, please get in touch with me or with Maria Bostonaro, who is leading this effort, and for the high quality training for research team leaders. At the moment, we have 33 countries involved in the project. This map is already out of date because Montenegro has been announced as one of our countries already, and I think Radenka Kirsmanovic-Witten is in our webinar today. And we also have a number of other countries that have expressed interest to join, including Armenia and United States and Canada. So we have very many organizations involved. I don't list any of the universities because there are so many of them. But the MRC Alumni Association, the Max Planck PhD Net, the N² network, which includes the Max Planck PhD Net, the Leibniz a PhD Association, and also the Helmholtz Juniors Association. Eurodoc, which is the umbrella organization for a National Association of Doctoral Candidates and Junior Researchers, is very heavily involved in the project. Vitae, the RAND Corporation, ReMO, which is a startup that was created by Francisco Gonzalez, and the SciLink Foundation, which Gabor is involved in and provides training for early career researchers. The Thesis Network, which is the German Association of PhD candidates and postdocs. The Euroscience network is particularly important because we have many Euroscience national coordinators who are the go-betweens between the European Commission and kind of the research landscape in their own countries. So they provide information on developing researcher careers, supporting international researchers for institutions in their own countries. So I think this is a very, very key group of people to involve in our project, because they give feedback to the European Commission on what works and what doesn't work, but they also give feedback to people in their own countries. So as these people are very key stakeholders for what we are doing. That how the process of how this project will work is that we will have dialogue and then kind of give feedback that will give feedback to education and training, and then we will have matching between people to bring researchers together to form kind of research collaborations. That will generate evidence, that will provide the basis for more dialogue. So I think that over the 4 years, we will have a process where we will, through continuous feedback, that we will kind of develop better research, but also better outcomes. And how you can take part, which is probably the most important thing, is to contribute to our manifesto, to our stakeholder workshops and webinars. That if you want to present your research as part of a webinar, I would be delighted to speak to you. Through our ambassador program, which will be launched next year, that through the short-term scientific missions, which please get in touch with me or with Maria Bostonaro if you want to apply for one. And this is, and kind of, if we should find a way to match people within our network so that they can set up these missions themselves. We will run summer schools, with the first of which will be focused on the ambassador program, and we will have 4 working group level workshops, I think, per year. And we will train and mentor early career researchers throughout Europe. That there's particular emphasis on inclusiveness target countries. This is mainly would be in kind of Horizon Europe or Horizon 2020. This is kind of more or less the widening countries, but it's this is kind of there will be special conference grants that you can apply for if you want to go to a conference, be it physical or virtual, and present something that mentions the ReMO project. please get in touch with me to find out how to submit a proposal. And our manager looking after that is I've forgotten the name, but I think that if you want to get in touch with me, I can set up the this conference grant for you, and we welcome applications. There's a kind of the project objectives are to build an evidence hub and to set up a training and dialogue network to create feedback loops between theory and practice, and to develop institutional policy and best practice guidelines. I think with that, I have probably spoken for half an hour, and I would welcome the chance to discuss the ReMO project with you, and kind of any feedback you can give and anything you would like to ask.